Ergot alkaloids causes hallucinations in central nervous system, vasospasm in the blood vessels and uterine contraction, and by that it leads to abortions in females. Ergot alkaloids are produced by Claviceps purpura, a fungus which grows on grasses and grains, particularly rye, and it grows in damp conditions. This fungus, along with ergot alkaloids, it also synthesizes histamines, acetylcholine, and tyramine. These ergot alkaloids will act on alpha receptors, dopamine receptors, and 5-hydroxytryptamine receptors, and they will show many pharmacological actions in the body. Welcome to Dr. Esmac Medici classes. In today's lecture, we will study the pharmacology of ergot alkaloids. Before entering into the topic, let us see one ancient incident which is happened related to Claviceps purpura. People consumed the grains which are contaminated by ergot alkaloids, Claviceps purpura fungi, and people had hallucinations, convulsions, and many people died and few people got severe abortions. These lethal toxic consequences of ergot alkaloids or Claviceps purpura contamination is called ergotism or Saint Anthony's fire, and most people in that condition they believed that it is caused due to demonic possession and it may be because of supernatural punishments. In ergot alkaloids we have two types, amine alkaloids and peptide alkaloids. Let's see the clinical pharmacology of ergot alkaloids. Ergot alkaloids are having some uses in the hospitals. Firstly, ergot alkaloids are used in migraine. Apart from ergot alkaloids, we have NSAIDs and triptans, which are very effective for treating migraine. So, in that, ergot alkaloids, particularly ergotamine tartrate, is one drug which is used in migraine. Apart from migraine, ergot alkaloids are also used in hyperprolactinemia. There is a condition called hyperprolactinemia where prolactin, which is synthesized from the anterior pituitary, the concentration is high. So excess amount of prolactin synthesis is called hyperprolactinemia, and which is usually caused due to the tumors of anterior pituitary. So in that cases, when prolactin level increases in the body, particularly in females, it causes amenorrhea, and excess amount of prolactin both in males and females, it causes galactorrhea. So in this condition we use ergot alkaloids. Bromocriptine, cabergoline and pergolide are the three drugs which are commonly used for hyperprolactinemia. Ergot alkaloids are also used in postpartum hemorrhage conditions, particularly usually we have oxytocin, which is the very important uterine stimulant and which is very commonly used for postpartum hemorrhage. But in some cases, if oxytocin is not effective, we will go with ergot alkaloids. The ergot alkaloid which is used if oxytocin is not effective is ergonovin maleate 0.2 mg intramuscularly, which is used to stop postpartum hemorrhage. Now let us see the adverse effects, toxicities and contraindications of ergot alkaloids. The common adverse effects includes on central nervous system. Usually ergot alkaloids will cause hallucinations, overdoses may cause hallucinations, and on blood vessels, as we know, ergot alkaloids are strong vasospastic drugs. They causes vasoconstriction, and due to prolonged vasoconstriction they may lead to gangrene, and further it may lead to amputation of certain tissues of the body. And on GI tract, if we see, ergot alkaloids will cause severe nausea, vomiting and gastric disturbances. And one more important point, ergot alkaloids in females, they are strictly contraindicated in pregnancy because it may lead to abortions. One important point about ergots, lysergic acid diethylamide is a synthetic ergot which is a strong hallucinating agent which is used to stimulate hallucinations in the body. If we see some examples of ergot alkaloids, firstly the ergot alkaloid which is CNS selective lysergic acid diethylamide, and uroselective is ergonovin, and vasoselective ergot alkaloid is ergotamine. So these are three examples. There are very few ergot alkaloids which are used in the hospitals. Ergot alkaloids are produced from a fungus called Claviceps purpura, and the contamination of this fungus, if animals and humans are consumed, it may cause some lethal consequences like the pharmacological actions, particularly on blood vessels. It causes vasospasm. In the uterus, it causes uterine stimulant and causes abortion, and in the GI tract, it causes gastric disturbances, and in brain, it causes hallucination. And when ergot alkaloids are taken directly, they will show some pharmacological actions as we have discussed, and sometimes the Claviceps purpura fungus will produce histamines, and it also produces acetylcholine and also produces tyramine. So acetylcholine adverse effects or acetylcholine actions can be seen with lacrimations, salivations, and diarrhea sometimes. Defecation also can be seen, and excess perspiration. When histamines are released by ingestion of Claviceps purpura fungus, it may cause allergic reactions, rashes all over the body, and headache, vasodilation, and it may also cause hypotension and further allergic reactions in the body. So that's it about ergot alkaloids. I think you might have understood some basic things about ergot alkaloids and the importance of ergot alkaloids in the hospitals. In the hospitals, we use only in three conditions. One, in the blood vessel, because we have vasoselective ergot alkaloids, and one to stop the postpartum hemorrhage, and one in the brain to stimulate hallucinations. So that's it about ergot alkaloids. Thank you for watching. Please keep watching my further videos as well. Thank you.